Imagine not being able to use one of your arms for common tasks like lifting or moving things around the house. Many people face that difficulty every day, but one local resident was able to get back to normal with specialized surgery and physical therapy.
My shoulder would pop out of place, so they had to reattach the cartilage, and um, there are anchors in my shoulder now.
For Jessie Helsel, surgery and anchors helped repair the problem with her shoulder, but that was just the first step in a longer healing process.
Jess has been with us for about 2.5 to 3 months. Generally, it's a process of a return to sport of about 7 to 9 months, as to which we'll start usually PT within 4 to 6 weeks after surgery. These surgeries are a little bit more precautious. They're protected a little bit more with immobilization to protect the repair. Then once we start with just gentle range of motion, progressing to light strengthening.
Aaron Mazza is a local physical therapist. He and others at Dynamic Physical Therapy helped Jessie progress from almost no use of her shoulder to being able to perform more advanced movements.
Initially, when Jess went home, we had her start with just some gentle active assistive range of motion things, lifting things like wands, broomsticks, using her good hand, her uninvolved arm to help the range of motion of her involved arm. And that's generally with any range of motion program, particularly one after a involved surgery, where you start.
I started out going like really lightweight and just moving my shoulder to the limit that it could go, like external and internal rotations, and then I just progressed with weight. There wasn't much that I could do.
There are many steps that must be carefully followed in order for patients to regain full use of an arm or leg after surgery. And experts like Aaron create a detailed recovery plan.
Generally, initially, when you have somebody, it's pain control. It's teaching fear avoidance techniques, but yet teaching sensible activities that they can start to do around the house once they do become more mobile outside of the sling, as well as with the appropriate home exercises and home activities that you teach them here in the clinic.
And those types of exercises are used to help many people. The exact details vary from person to person, but the injury and recovery process that Jessie went through is not rare.
This kind of an injury in athletics is fairly common, not as common as what we would see with an ankle sprain or possibly even a ligament sprain in the knee, but it is more common than not. The problem with this injury is that it occurs once, it's more likely to occur again and again and again, which chronically will result in necessitating this surgery that Jessica had.
For My News 26, I'm Kayla Kiley.